Hi all, welcome back. Continuing my little series of videos on gains without pains, correct technique on basic exercises that you do in the gym. I am today going to be talking about squats. Again, I want to emphasize I am not a personal trainer. If you are coming back into the gym following injury, or you're starting out on an exercise plan in the gym, do consult with a personal trainer. The information I'm giving you today is based on my knowledge of anatomy and physiology, how the muscles work during these exercises, and therefore where this sort of stress of these exercises is placed, on which joints, which muscles, and therefore how to avoid injury. Part of my job as a sports therapist is it's actually about educating people on how to prevent injuries, how to, maintain their posture, use correct technique, so that they can continue, to succeed with whatever exercises they're doing, that they can become fitter and stronger. My job isn't just a case of give someone a massage and then, see you later. So this series of videos, you'll know if you've watched the others, basically look at common exercises done in the gym, and I will be talking about the common mistakes that people make when doing these exercises, and also how you can take a look at your posture and use good technique to reduce the risk of injury. So as I've said today, we are going to be talking about squats. So benefits of squats. Well, they give a total lower body workout, focusing on the glutes, the hips, and the thighs, as well as also working those core muscles. And by adding weights, you can also actually include an upper body workout as well. So these really can work a lot of muscles at the same time. So, common mistakes that people make when doing squats. Their knees may internally or externally rotate. What this does is it increases the stress on the knee joint and on the surrounding ligaments. Usually it's due to some kind of weakness in those quad muscles at the front of your thigh. If this is combined with sort of poor alignment of the hips, it can actually lead to back injuries. So, and also, it will, we've spoken, you might have seen my previous video on the IT band, but if your knees are pointing, turned inwards or outwards, actually that could also, through repetitive movements, cause irritation of that IT band, and again, it causes the IT band to cross the knee at a slightly different angle, increases the chance of inflammation, and also can cause knee and hip problems. If the toes turn outwards, again, this is increased pressure on that IT band and the muscles on the outside of the leg, whether that be the calf or the outer thigh. Also if you're turning your knees outwards, the likelihood is you are not engaging those glutes properly. And, I'm pretty sure that most of you out there who are doing squats are doing it to get a good bum and really engage and strengthen those glutes. So don't turn your toes out. Now, going back to the knees, if the knees move past the toes when you're at the bottom of the squat, you may experience knee pain. So there's sort of a lot of debate about, whether the knees should, go ahead of the toes or sit behind the toes. But certainly, in my experience with people who have, maybe strained their calf or their knees, and sometimes even their ankle, and having problems squatting, that it's sort of that experience. That's why I'm sort of saying, don't move the knees past the toes, because it will increase your chance of injury and excessive strain on some of those joints. Also, if you lead with your knees, this can actually cause quad dominance. So you're going to be overworking those quad muscles at the front of the thigh. The whole point, as we said, of squats is to primarily engage those glutes. The hips should be going backwards. And that way you will get full extension at the top of the movement. And you'll be able to re-engage those glutes before you lower down again. Now, if you have tight hips, you may find that the knees will go forward unintentionally. That's where, I would say, do some work on those hips, get the hip flexors strong, so that, you've got stability in the hips and you've got the flexibility there, and then, pursue your squats. Sometimes people squat too low. So if you squat past 90 degrees, this again will put too much stress on the knee joints and also on those quad muscles at the front of the thigh. And it doesn't really provide enough leverage, to push from your glutes as you stand up. And it may also increase the risk for potential lower back pain or lower back injury. And so if you think, you might be guilty of this and, basically taking the squat too low, another, good way to try to control this a little bit is squat against a wall. And that way, you'll sort of get the hang of sort of how far down to go. Now the only other thing with that is that it's more difficult to push those hips back if you're against a wall, but just as a starting point, it can help you sort of recognize how far down you should be going. Now, the main power for doing a squat usually comes from pushing through your heels. And this is certainly a sign for me as a sports therapist. If I see clients and they do a squat and their heels are up, that's usually a sign of an issue, certainly with the calves or potentially even, the knees or the hips. If you shift your weight onto your toes, then what happens is that kind of moves your whole body forwards, which means that you then have a higher potential for a knee injury. There's going to be more strain through that knee joint, and also you're going to be, putting too much stress through those ankles. And again, this position, it just doesn't give you the leverage, that you need in the hips and the glutes, which is, the focus of these squats, and can lead to an imbalance or, again, over-dominance of those quad muscles at the front of the thigh. Another common mistake, as with many of these exercises, is not engaging your core muscles around the abdomen and the back. When you squat, your core muscles should be engaged. You should be driving through those heels and the glutes as you stand back up. And also, using those abdominals. And by stabilizing those inner core muscles, you can also maintain a neutral spine, which will also help avoid putting unnecessary pressure, on your back. Certainly, rounding the back, as you said, by keeping the spine in a neutral position, good posture can really determine, how efficient your squat is. Looking upwards, if you're curving that cervical spine around your neck, that's going to put you at increased risk for disc injury. Leaning too far forward, as we've said, if you push through your toes, again, that's going to overly round the back and stress, the spine and increase the chance of injury. So just maintaining, good spinal alignment, will really help you with your squatting technique. We've said it before with some of the other exercises, by, rushing through the technique, rushing through the movement, and the repetitions will certainly maximize your chance of injury. Take time to breathe properly and just focus on each stage of the movement to ensure that you are engaging the correct muscles. Because when you start speeding through it, it's usually because you've got some weakness in those muscles anyway. So just work on developing the strength of the muscles that you're going to be engaging. And, even if it means doing less repetitions to start with, just work slowly to really make that exercise efficient. And, we mentioned breathing. Don't hold your breath. It is crucial during a squat to breathe into your belly, not just through your chest. Breathing through your belly, deep breathing, will help to stabilize that core. And by inhaling gradually as you squat, you'll find that you have a much more controlled movement. And then exhale slowly as you press those heels into the ground and rise back up, obviously engaging those glutes. So good technique for squats. Stand with the feet shoulder width apart, slightly turned out, but not too much. When lowering into the squat, tighten that core and those glute muscles. Keep the weight in the back of the heels to avoid knee injury. Keep the chest up, shoulders back and down, and don't lean forward. Okay, drive the knees outwards. And if you are including weights, increase them slowly once you've perfected the technique. Don't go straight on in there with a weight, because you're just going to put too much stress on the joints. You're probably not going to maintain that spinal alignment. So just get the technique right, and then you can add the weights in at a later date. So that is your squats. So a few things to look at there if you feel like you're having some issues. But as always, feel free to comment down below, subscribe to my channel. I will be doing more of these videos on other exercises. My next video will be talking about the leg press. Keep your eye out. You can always contact me through Facebook or Instagram with any questions. But until next time, that's all from me. Happy squatting. See you later.